Hello, everybody, and welcome back to another edition of the One Hood Power Hour. I'm your host, Royce Jones. This news program is meant to give you some updates about what's been going on around Pennsylvania and Pittsburgh, of course, as well as speaking with people who are in the news so that you can understand how you are impacted and what you can do to make sure that your community has what it needs. Now, as always, please remember that you can drop any questions for our guest tonight in the comment section wherever you are streaming. Our first guest is Dan Yablonsky, Director of Communications and Development with Pittsburghers for Public Transit. After a drunk driver left him in a coma, hospitalized and unable to walk for months, Dan became a committed advocate for the dignity of those who travel without a car. He works with PPT to center riders as leaders in campaigns for accessible transportation, affordable housing, public transparency, and our shared right to the city. Let's everybody welcome Dan to the chat. Hey, Dan.
Hello, Royce. How are you? Thanks for having me.
Good. Of course. Thank you for being here. I'm well. How are you doing?
I'm doing okay. It's some long days these days. I'm sure folks have seen that there were some pretty scary announcements that PRT had a few weeks back, announcing that service could be cut as much as 40%, that fares would go up, that all transit would stop in Allegheny County after 11 p.m. As you can imagine, there's a lot of work to do.
And a lot to get into, and I want to get into all of that. First, could you talk to us a little bit about what it is, you all do at PPT? Let's talk about some of your work there.
Yeah, absolutely. Well, I love the work that I do at PPT. Our acronym PPT stands for Pittsburghers for Public Transit. That can be a mouthful. PPT works well. But we are a union, a grassroots union of public transit riders and public transit workers and neighbors who all care about public transit. Together, we organize for expanded public transit, one that's accessible and affordable for every community, and meets all of our community needs with nobody left behind. So that's who we are. We've been around since 2012 or 2010, depends how you count. Fortunately, and it's a beautiful thing about public transit here in Pittsburgh is that there have always been people who have been advocating for public transit. So the work that we do right now in our union is work that builds on generations before us. So really honored to continue that legacy. And like you said in the bio, we continue this fight for our right to the city.
Yeah. Now, your involvement there, was this something that was born out of your incident? Were you already there? Talk to us about how you kind of got involved.
Yeah, well, I came to Pittsburgh in 2012 is out of school. I was looking to do work in sort of environmental sustainability things. It was 3 months after I got here that I got hit by a drunk driver while I was riding a bicycle down at the intersection of Heron and Liberty, kind of by the Strip District if you're going down from Bloomfield. Middle of the night, someone hit me, left me for dead, actually drove off with my bicycle stuck in the grill of his car and stopped at Doughboy Square at Penn and Butler to pull the bike out of the car, throw it on the sidewalk, and just took off. And, he wouldn't have been, ended up getting turned in. But, only because the next day was Mother's Day. And so his mother called the cops to be turned out he was on a suspended license, 4-time DUI. And so she turned him in. And so as his mother was making that call, my mom was getting a call from the hospital here, in Pittsburgh, saying that her son was in a coma at that point. And this is all to say that this is just the beginning of 6 months of recovery in the hospital, a year of learning how to walk again, and almost for the better, I don't remember those first couple weeks. But you ask, is the work does it come out of that? And the answer is absolutely, because it was sort of in that recovery, both like being unable to walk. I was in a wheelchair for a very long time. That it happened while I was on a bicycle. I was just trying to get around, trying to get through my city, to meet friends and build community and build connection with the city. But because I didn't have a car, I was exposed to I was exposed to a driver, but it was really what we expose everybody to if you don't have a car and you're forced to walk or bike or take public transit. And so the work that I do right now is for the dignity of people who don't have a car, who need to walk, who need to take the bus, who need to ride a bike. After I got back and walking again, got back to Pittsburgh, I spent, I think, 6 years working with Bike Pittsburgh. It's an organization that was doing bicycle, or still does, bicycle advocacy here in the city. I think it was about 2016. So it was actually like, and sorry if I'm going on long here. So,
okay. This is your story. Hey, this is your story.
Please direct me how I need to be. But it was around 2016, and it was around the evictions at Penn Plaza in East Liberty. I got really involved in some of the organizing at that moment, and sort of seeing how housing is intrinsically connected to access, to transportation access. And so, as people, there were almost 300 people were kicked out of those buildings by the property owner. Those people all got pushed to outside the city, by and large, into communities that have worse access to grocery stores, to jobs, to healthcare. And so I got to sort of the only group that was actually in those buildings organizing was Pittsburghers for Public Transit, because they do have this organization. We have a deep understanding that transit goes far beyond infrastructure. It goes far beyond the bus that runs on the road, or the paint that's painted, the crosswalk. Like, transportation access is the communities that we live in. It's the housing. It's who can afford the housing. It's the policies to shape all of these things. And really, it's that access is community, is healthcare, is food. There's just so much that transit and transportation connect. And so it's sort of with that understanding that we do the work that we do, and that I do the work that I do. Public transit is food access. It is education access. It is access to our jobs, and eventually it's healthy communities. So that's really what we're fighting for at PPT.
Yeah, and so with those things that you mentioned, that you have seen, especially in East Liberty and your work there, and I'm sure other communities as well. You already sort of hinted at this, but I'm certain those changes within PRT are really alarming for you. Could you talk about what your concerns are with that?
Yeah, well, public transit in Pittsburgh, in Allegheny County, it is the lifeblood. Whether you ride the bus or you don't, we all benefit from public transportation. Transit gets us to jobs. It's good for our environment. It takes emissions out of the air. It takes cars off the road. So if you're a driver, you're benefiting from public transit because you're not behind a bus full of people. who would otherwise be in cars. It gets people out into their communities. It gets people connected to all the vibrancy that is in our city. And that for the last, for a long time, transit has been in decline. And most recently, since the beginning of the pandemic, we've seen service go down 20%. Even though ridership has been growing since the initial pandemic drop, when we were all social distancing and in our houses. That said, transit funding in Pennsylvania, just the way that transit funding works, it has not changed in nearly 15 years. So we're still at 2010's level of funding, despite inflation, despite the way that worker costs rise, that the cost to run these services changes. So transit agencies are being asked to do, more than they've ever been done with even little or smaller amounts of money. So in that position, it makes, it's not surprising a month ago when we heard PRT come out with the fact that 40% of service would have to be eliminated here in Pittsburgh. So that's to say that our anger is not at PRT. PRT is not our target because they have their hands tied here. They're tied by a state funding that hasn't gone up in nearly 15 years. So what we're doing and what we know we need to do and succeed in is to win more dedicated transit funding at the state level. Yeah, we can talk about the campaigns that we have running, the ways that we're going to do that. But yes, it's some very scary proposals from PRT with the service reductions, fare hikes, capping all service at 11 p.m. So you won't be able to get a bus home or to a third shift, home from a bar. Just like it will have devastating effects in our communities. And so the call to action is that we need to all be organizing together because we can win more funding. We can win more transit access, but only if we come together to demand it. So.
Yeah, I know you mentioned, just how funding hasn't changed, or at least it's been stagnant. Are there any changes this funding year in terms of less? I mean, I know we haven't seen more, but do we happen to ever be seeing like less funding as well? Or are we also fighting against that?
Yeah, so sort of what is at the intersection this dangerous intersection that we find ourselves at right now is both the fact that our state transit are the money to run the buses in our system, our operating money, that all comes from the state, almost entirely comes from the state. That money has not gone up in 10 years. Or, I'm sorry, in 15 years, since 2010, 2013-ish. That said, when the pandemic happened in 2020, everyone remembers there were all these federal bills that sent lots of money to critical needs to help keep us safe during this pandemic. Some of that money went to transit agencies, and that money allowed our systems to be run to keep the lights on. Remember all the talk about essential workers, people who need to get to the hospital, to be your nurses, to keep the facilities clean. People the grocery store workers that need to keep our food access open. Those people all ride public transit. So again, like I'm saying, you don't need to ride public transit to benefit from it. So this pandemic funding was keeping our transit agencies going. We're also at the intersection of the end of that pandemic funding. That's, it's 2025, whether or not we're actually out of the pandemic, I guess is arguable, but the impacts are are leaving agencies with at sort of like a funding cliff. So the cliff of the end of the pandemic funding, the cliff of state funding not rising with inflation, right, leaves PRT between a rock and a hard place. They come out with this proposal to cut service, but they're not alone. In Philadelphia, this was just 2 weeks ago at this point. Philadelphia also came out with a proposal for what they're going to have to do if the state does not expand their transit funding. And similarly, this is Philadelphia. It's a huge metropolitan city. I think it's the 5th largest city in the country. That they would have to cut their service by 35%, increase their fares. That there are train lines that they would have to stop at 9 p.m. There's just not going to be trains from 9 p.m. until 6 in the morning. And like, it's not even that Pennsylvanians rely on Philly's transit, or not even that people in Philadelphia rely on SEPTA. It's that the entirety of Pennsylvania relies on SEPTA, because services that fund food stamps in rural PA all get money from Philadelphia, all get money from Allegheny County. These two places with these two huge transit systems are the economic generators in our state. They fund all the social services that everyone across the state benefits on. So yeah, it's the pandemic funding, and it's the fact that state funding hasn't gone up. Leave agencies in Pittsburgh and Philadelphia to have to come out with these really scary proposals. Yeah, I can keep going on, but it won't stop with just Pittsburgh and Philly, because transit is not just an urban issue. Transit exists in every single county across our state. So there's 67 counties in PA. Every single one has some form of public transit. They're all getting money from the state for those public transit systems. Obviously, they're not subways, they're not trolleys, they might not even be fixed route bus lines, but they are the dial-a-ride, medical rides for families to get to appointments, for disabled people to get to essential services in their community. So that those agencies too that are providing those services are going to have to come out with their, and we're already seeing it. We saw in Washington County last week, they had a similar press conference that was like, we're going to have to raise our fares if the state doesn't give this money in. So, it's not just an urban issue. Transit's not just an urban issue. It's a rural issue. It's an issue for small towns. And it's a scary place that we are in Allegheny County, but we're not alone. And transit riders across the state have a lot in common, and we are building that movement to come together and win this funding at the state level. So we can talk about that campaign in a bit, but that's sort of the situation. It's the ground that we're standing on right now.
Yeah. So what would, in an ideal world, what would things look like if we had a budget that properly supported public transit?
Yeah, I mean, if we had abundant transit access, imagine if you had the bus and maybe if it wasn't even every bus line, right? We have core high ridership lines coming every 5, 10, 15 minutes. We see that as freedom. That is freedom. You don't need to have a car. You don't need to have all the bills and the insurance and the uncertainties, the headaches that come with car ownership. We are investing in the public services to keep us moving, to keep our neighbors moving, to keep our communities moving. When we talk about public transit, frequent, reliable public transit, we're talking about freedom, and not just our freedom, but the freedom of everyone in our communities. So
Yeah, and also I want to ask you. I mean, are lawmakers concerned about this? Policymakers. Is whoever is leading our state, are they expressing concern when people or agencies um, Pittsburgh Regional Transit or the transportation agency in Washington County or Westmoreland or whoever is making announcements like this? Are they listening to what's coming, the news that's coming out, and how people are being affected by this? Is there a light at the end of this tunnel?
Yeah.
Where are we?
Well, totally. I think the good news and the great news and the powerful news and what carries me through all of this really hard news right now is that riders across the state are organizing under a campaign called Transit for All PA. And this is a campaign that we have had the honor of leading and organizing since 2001. This was when the state's transit funding was just tapering off. But it's a coalition of riders from rural PA, from suburban PA, from urban PA, Philly and Pittsburgh, and every place in between, who are saying that we need expanded public transit access in our communities. People can get involved at transitforallpa.org. We have a vision to, through our organizing, we've elevated public transit as a top priority in our state right now. So for the last 2 years, we've convinced Governor Shapiro to have transit funding in his state budget. And so this year, February 4th is when he delivered his budget address. He said he had a plan to give some level of funding to our transit agencies, and it's an important start. But if we just go forward with the governor's plan, it's going to result in a service cut. It might not be as bad as 40% that the agencies have said they would need to do to keep their budget straight, but we'd still have some substantial level of service cut. So we were successful in getting this in the governor's budget address, but we want to go further than that. We don't want the status quo. We do not want continued cuts in our system. So our coalition members, our grassroots members have put together a plan to restore transit service in Allegheny County and Philadelphia to 2019 levels pre-pandemic. So that would be currently a 20% increase from our current levels of funding. Plus, we want to show that transit can be so much more for small communities around the state, for rural communities. So in addition to restoring their service to pre-pandemic levels, we want to see transit increase 10% in those communities. So those are our goals. We've put together a funding package to do that. Our researchers have looked at taxes that haven't gone up in 30 years since they were introduced, like the car rental fee, the car lease fee. These are taxes that get paid by and large by people with expendable income. They're not as regressive as just a flat sales tax that everyone has to pay regardless of your income. And we're looking to some other mechanisms that can raise money, plus giving counties like Allegheny County and Philadelphia County the ability to raise our own money. And it's through this funding package that we can succeed in our goals of restoring service to 2019 levels and expanding it even beyond that in our rural communities.
So we have that campaign. What about the National Transportation Advocacy Spring Training? That's different, or is this a part of that campaign?
Well, so I'll say first, join us to join this Transit for All PA campaign to raise our voices and say that we want more public transit funding in our state. mark your calendar for April 29th. So this coming Tuesday at 1:30 p.m. before Pittsburgh Regional Transit's first public hearing on these service cuts. We're going to be rallying outside the convention center alongside County Executive Sarah Innamorato. Mayor Ed Gainey will be there. We'll have hundreds of transit riders, people who care about expanding our service, about the connections that transit represents. So join us. You can find out about that rally on our website. We'll put that in the show notes. You can drop that in the chat. But yeah, the convention center, so it's 955 Penn Avenue on Tuesday, the 29th at 1:30 p.m. To join us to save our transit service is our rally. So we mentioned our movement. We mentioned the ways that we're going to raise our voices at this rally. Now, we're only going to win when we can grow a movement of organizers who are standing to say that public transit is a human right, that bus lines are lifelines, and that we need our elected officials to truly invest in our service. The way we're going to do that is we're going to train that movement. So this weekend, Friday and Saturday, we're hosting here in Pittsburgh, Pennsylvania, the National Transit Advocacy Spring Training. This is going to be really exciting. We've got presenters coming in from all across the country, from as far as Seattle, Georgia, Texas, New York, even Ohio. Folks will be there bringing the skills that they have from their different campaigns, places that they've been successful, tactics that they have used to influence their legislators, to build support among their communities. So we'll have a happy hour kickoff, just a meet and greet on Friday. You can join us. We'll be at 1800 Smallman at Aslan Beer Company, having a good time, meeting lots of great people. And then the magic starts, the training starts Saturday, the next day at 8:30 over at the Courtyard University Center, the Marriott over in Oakland. We have a free breakfast. We'll have a plenary to sort of set the groundwork for the day. And then there's a series of 3 workshops where we're doing everything from learning how to share our stories effectively with politicians, to media trainings for how you can get on the news and successfully share your story. We'll do mobile workshops where we are going to be out in the community looking at this is a great sidewalk, and sidewalks help transit access. Obviously, it gets people to the bus, or this is a crosswalk. And then these are the ways that we can win more of this in our communities. So that's all happening this coming Friday and Saturday. It's the National Transit Advocacy Spring Training. Folks can sign up for that at our website. Again, Pittsburgh for Public Transit. We'll drop that in the chat. And yeah, we absolutely want to see you Friday. We absolutely want to see you Saturday. And those are to build our skills for this rally that's coming up on Tuesday, the 29th, and this campaign that's going to continue into the end of the June budget season at the state. So that's
all
us.
Right.
Thank you.
All right. Well, sounds good, Dan. Thank you so much. And we'll make sure we get those links posted in the comment section for you guys. And hopefully you have a good turnout. I think you will.
Absolutely.
All right. Thanks for your time. We'll talk soon.
All right. Bye.
Bye. All right, everybody. So our next guest, Céshia Elmore, is an activist, educator, and artist based in her hometown of Philadelphia. Céshia was a special needs educator for nearly 15 years, shifting her professional focus to grassroots activism in 2020. Although viewed as a public figure in the Philadelphia queer community for 15 years, her activism was ignited after the devastating murder of local Black trans woman Dominique Remy Fells. She partnered with New Voices for Reproductive Justice as a concerned community member and is now their organizing manager. Since then, she has mobilized for abortion rights, organized for gender-based violence, and developed and facilitated workshops and training about reproductive justice and birth justice. She continues to explore her visual and spoken artistry while intersecting it with her activism. That said, let's everybody welcome Céshia to the conversation. Hey, Céshia.
Hello, hello. Thank you so much. You can hear me okay, right?
Yes, yeah, we hear you.
Okay,
The light
great.
is good. Everything is great.
I love that. Usually when I do StreamYard, I'm the one that's on mute for like 2 minutes.
No, it's perfect. It looks good and it sounds good.
Yes, thank you so much for having me.
Of course, of course. And you're in Philly now. Is that where we're talking to you from?
Yes, I'm based in Philly. Yeah.
Nice, nice. Well, welcome virtually to Pittsburgh and beyond here in southwestern PA. Would you talk to us a little bit about New Voices? What kind of work do you guys do over there?
Absolutely. Thank you for that. Yeah, we are a Blackity Black organization. We build power for and alongside Black women, Black queer folks, and other Black marginalized groups, engaging those folks or our folks through community organizing, voter engagement, and policy and advocacy. So our focus is building the next generation of leaders, and particularly repro justice leaders through our leadership development programs, providing political education, and overall facilitating community care.
Nice. Now, we just had Black Maternal Health Week. Was that last week?
Yes.
Okay. Could you talk to us a little bit about that and how that kind of intersects with the work that you all do?
Yeah, so Black Maternal Health Week happens annually from April 11th through April 17th. And it's really a time to highlight not just the disparities that happen amongst Black birthing people, but to beef up the advocacy, right? The awareness of what's really happening in these interactions between Black birthing people and our healthcare professionals. And so Black Maternal Health Week was a time designed to celebrate Black birth workers, our doulas, our midwives, the folks who help us through these, very naturally occurring experiences, but to also keep folks aware about the disparity and impact of the birthing experience, particularly with Black birthing people. And so at New Voices, we believe that birth is a joyful community building experience, right? Excuse me. The creation and building of our kin should be on our terms, and we deserve expansive, culturally responsive healthcare. But in order to do that, to reduce like the environmental and socioeconomic factors contributing to the Black maternal health crisis, healthcare must be rooted in equality, seeking to understand and adequately tend to the full range of patient care needs, right? So this is when we start dipping into those like social determinants of health, like how all of these external factors, which we know are rooted in oppression and systemic racism and patriarchy, and the impacts that has on our bodies and the ways that we are able to raise our families in safe and sustainable communities. So that's the direct connection, right? Black maternal health is reproductive justice.
Yeah, and was there anything specifically that was there a specific theme this year? Anything that was really a primary focus as we recognized Black Maternal Health Week for 2025?
Yeah, so this year the national theme was healing legacy. So really touching on all the work that has been done up until this point to better the outcomes of the Black birthing people in our pregnancy and birthing experiences, and how we are going to move beyond that and moving forward. And I can say, particularly at New Voices, we like to focus on the conversations that aren't always included in that larger conversation. We want to relate our points to our community, right? So what does it mean to parent and be queer, or Black and trans, and what those disparities are. We even hosted a conversation this past Black Maternal Health Week about non-traditional parenting, right? And how that is still very much part of the conversation. Mental health beyond this, very acute postpartum phase that's often described. So how are we also like uplifting conversations that impact us as everyday people outside of, the waiting room, the delivery room, the patient care room? And how do we, move forward from there and open the door for these conversations?
Yeah, because I know, and that's good to know, because I think when you hear the word maternal or maternity, a lot of times you may associate it with birth only, only birth, and you're not really able to. Some people might not be able to see past that. So it's good to know. I think just the robust scale, of topics that are covered within this beyond just birth. We know that the like mortality rates, for Black mothers, and such and so on are staggering. What are some of the challenges, that Black mothers may face? What are some of the issues? Like, where are we in terms of like Black maternal health and our concerns?
Yeah. So what we see and what we experience is deeply rooted in implicit bias, and that really is a derivative of these like white supremacist structures, right? Like every system that we have to navigate was actually designed to oppress us, and the medical system is not different from that. So that would be the largest barrier, right? Like we have a history of mistrust with the medical community because of the ways that Black women and Black people have been experimented on, because our pain and our calls for care has not been, taken seriously. So as the mistrust builds, right, some folks are aversive to even going to see a doctor, and that can be a barrier in itself, right? I think another obstacle that we encounter is this lack of culturally competent providers. Like not having someone in the birthing space that looks like you, that can speak to your lived experience. And even if they are not Black and woman, right, can they at least honor your lived experience? And sometimes we see that as the barrier, especially as we talk about like our pain not being believed, or us over being labeled as overreacting, or being labeled as drug seekers, right? Like all of these things dwindle down into the bias that is rooted in what our healthcare professionals have been taught, right? So all racism is baked into these very curriculums that shape today's doctors, right? And so that is a very identifiable root. So these kind of like people relations outside of that. Let's just be clear, there's nothing wrong with our bodies. Black women's bodies are not made up differently, organically or chemically, to deserve some kind of altering treatment. So let's just, make that clear. But because of this very like sordid history that we have with medical institutions and practitioners, it really puts us at a disadvantage for getting the equitable care that we need.
Yeah. So what needs to be done to address issues like this, to address the Black infant mortality rate? What do you do? Is it the hospitals? Is it the communities that they are in? The hospitals are residing in themselves that need to do something.
Mm-hmm.
How do we address it?
Yeah, I think a good place to start is that like mandatory implicit bias training, right? Like starting with, removing all of those things that you think about Black people and our bodies, and actually listening to the patient. I think that would be a good start. Doulas have been a huge part of the equation. It has been proven, and this is part of, having that advocate by your side, who understands you, your lived experience, and even your culture, right? Doulas have been proven to assist with better birthing outcomes for our folks, right? So advocacy at the highest level matters. Using legislation as a tool, right? Like we know that our liberation can't be legislated, but it is a tool that we can use to advocate for the things that we want, and not being fearful about holding these healthcare institutions accountable. So much gets swept under the rug, and so much is downplayed just because of who we are. We're either overreacted or underdiagnosed, and all of that is not by accident. So holding our healthcare institutions accountable is also part of the equation as far as like action items go. You ready to jump in? Go see your legislators, go down to these hospital boardrooms, and tell them what's really happening in the space with our Black birthing people.
Yeah, and I know that when these healthcare organizations aren't doing the right thing, that you all at New Voices are there and ready to step up to the plate. So what are some of the programs and services that you all offer there?
Yeah, so we partner with birth workers. New Voices is not a direct service organization, but we are deeply tied to community. So when members come to us with their harrowing stories, we're able to connect them with a birth worker or connect them with an organization that does this work specifically. So we partner with birth workers and Black serving organizations throughout the year, and specifically during Black Maternal Health Week, to really elevate that message of how important it is to move beyond this disparity. Also, we provide education on reproductive justice. We bake that into our leadership development offerings, and pretty much any training or talk that we do, making sure that people are informed about what repro justice is. I also facilitate a training on advocacy and activism in birth work, which has been a part of a local doula training program here in Philadelphia for several years now. So education is also key. And we hold space for this work in our leadership development cohorts and our political home spaces. This year, our leadership development opportunity is running through May and June. And this will be the third cycle of our organizing cohort. And it is always packed with doulas, because doulas and birth workers are practitioners of reproductive justice, right? And so there is something to be said about deepening your understanding and knowledge of repro justice and how you can actually incorporate that and organize and provide care from an RJ-centered lens. And so that is, you know, training that that we provide. And our political home spaces are newly launched, but there's spaces for us to expand on these conversations, you know, beyond the screen. How can we create, really facilitate this cycle of care between one another? How can we support folks who are going through these challenges that are particularly related to Black maternal health and its disparity? So those are ways that, like, we kind of get active or offer for folks to plug in. But the work is, you know, with community. Like, we can't do it. We can't do it by ourselves. I believe in, I can be probably quoted in saying this everywhere I go, I truly believe in the power of people, that the people hold the power, right? And it's all about getting us all on the same page. And so that's what we do. We facilitate that education. We provide these resources and knowledge bases needed for people to really advocate for themselves and hopefully get the person next to them activated as well.
Yeah, and if anybody's watching this, you know, here in Pittsburgh, or I don't know, the internet, you never know. Maybe they're in Albuquerque or wherever, somewhere, you know, and they see this and like, I think New Voices is the organization for me. I would like to be involved with them. Is there any way people can get involved with your work outside of the Philadelphia area?
Oh, absolutely. So we're also based in Pittsburgh. We have
Oh,
folks on the ground there. We have an organizer there. We have a voter engagement team there, and then we also have a base in Cleveland, Ohio, which I know you guys are closer than Philly and Pittsburgh are.
yeah.
Actually, but I love all three cities. I spend time in all three cities because our organizing touches all three cities. So yes, please do. The applications for our leadership development program are actually open until Sunday at midnight. So yeah, feel free to drop that. You can find it on our website. We have a brand new website. It's beautiful, if I do say so myself. But
Nice.
do take time to visit newvoicesrj.org. And if you're looking for our leadership development program, you can navigate the menu, but it's newvoicesrj.org/defendourkin.
Nice. And I know, you know, that reproductive rights, you know, are really at stake, and I'm sure that a lot of the work you do even is at stake. The causes that you stand for, even perhaps funding, you know, could be, you know, at risk. So um just your thoughts on that. Your like your message to people of, you know, why it's more important now than ever to be involved. Yeah, what are your thoughts?
Yeah, it's important because Black women are dying. Black people are dying at a rate 3 times more than our white counterparts nationwide. We have the highest mortality rate of any developed nation. It's important because we deserve reproductive justice, right? We deserve to have our children, or to not, or to and to raise our families in safety. So, you know, quite frankly, if we can't do that, we can't do that if we're unalived, right? And you know, 90% of these pregnancy-related deaths are preventable. And so that's where the bias comes in, right? Like, where is the gap in our care? If this could have been prevented, but we're seeing a disparity that impacts us 3 times more than our counterparts, and even above, other people of color. And so there's, one really strong factor that speaks to that. I remember when I first started organizing, somebody told me that the answer to everything is racism. They're like, why this? Why, why that? Why are we experiencing this? And you pretty much could say racism to all of those things. And this is not that different. Right. And so that's why it's important, because Black women and Black birthing people deserve to thrive.
Mm-hmm. Yeah. And, lastly, I know you mentioned your beautiful new website. How can people get in contact with you?
Yeah, so you can get in contact directly with me by emailing me. It's my first name, Ceshia at newvoicesrj.org. If that feels like too much to remember, you can also email organizing at newvoicesrj.org, and make sure that you're following across all of our social channels, which is also New Voices RJ. So Instagram, Facebook, and TikTok, you can find us at New Voices RJ.
Nice. All right, Céshia. Well, thank you so much for taking the time to be here with us tonight, and talk about this and your work. And hopefully we'll be talking to you again soon.
Yes, of course. I love One Hood. So anytime y'all need me, just hit me up.
All right, perfect. Hey, it's a standing invitation. When you want us, come on, we'll have you.
Yes. All right. Y'all have a good night. Thank you so much for having me.
Thank you. You too. And we want to thank all the rest of our guests tonight, and all of you at home watching. We hope that you were able to learn something this evening and walk away more informed and enlightened. One Hood Power focuses on building power by reaching out to our communities who have been traditionally excluded, forgotten, and under-resourced. While we engage all voters, we specifically focus on the policies and platforms to improve the quality of life for our Black, people of the global majority, disabled, queer, youth, immigrant, and Muslim communities. Today, we talked a lot about different policies that impact people's lives, but remember, people can impact policy, and we do that through our vote. As you know, there is a primary election happening on May 20th, so please make sure that you are registered and ready to go and up to date and current with all your paperwork for that, so that you can hit the polls or send in your mail-in ballots. So make sure you are prepared. Thank you guys for watching tonight. My name is Royce Jones. I'm your host, and we'll see you next week.